I thought about it and I was like, I wonder how many people have been misdiagnosed. You know? I'd like to think I'm a pretty credible person, right? But again, this could happen to anyone. So I wonder what happens when people like went into doctors' offices as far back as the 1800s, when we have record of this first being a thing, and what they said to doctors, or what they said to people in their villages where they were living, whatever they do. Like, I really wonder what people told them, because we even have trouble like getting people to believe us now. And modern medicine supposedly really advanced, so what's up with that?
I don't think of myself as a believer in visual snow. I think of myself as someone who's open-minded enough to listen to patients with a problem and try and understand it, and then ask questions about it. I see myself more as a clinical scientist trying to open-mindedly ask a question. I don't want my colleagues to believe it. I want them to understand it.
So in terms of what I would say to doctors who refuse to acknowledge or diagnose visual snow, well, hopefully it won't be that far away when we can actually give them some evidence that this is a real thing, and that's not too far off. As I said, we're collectively as researchers creating bits and pieces of that puzzle that allow us to start publishing those findings, put it out there in the literature, and start demonstrating that we're actually seeing physical changes in the brain. How would I go about changing their minds? I think forums like this particular conference, that's a great start. It's yelling from the rooftops, really. It's actually making a lot of noise about what we're finding, publishing the findings, presenting the findings, making it really clear within the scientific community that this is real. Noise and lots of it.
Well, I would suggest that they get a little more up to speed and look at some of the material I've presented and other people have presented in the last 10 years. It's a real event. I mean, I have statistics on well over 150 people, and I can quantify the situation in visual snow fairly accurately, to the point of knowing it's pink snow, not white snow, things like that. That's where we are right now. We need to get more communications out to other people, but there is a real phenomena there. It's difficult to tie down at this area of science at this time, but it's definitely there.
You ask, what do I say to people to doctors who deny its existence? I usually tell them they're out of date. It hasn't accumulated a lot of friends for me, and I usually point them to the literature that is now conclusive in that regard. And to be fair, we're making significant headway in educating people about visual snow being a real entity, and that to a large degree is a result of the work by Dr. Peter Goadsby and his groups. Changing the minds of a profession that is fairly hidebound and conservative takes time. And the only way you can actually do it is by teaching it at a very junior level, and we all have some medical student teaching responsibilities, but also presenting the data at professional meetings and trying to achieve dissemination of the information over time. The medical profession is extremely conservative in accepting new ideas, and even though neurology is a well-respected subspecialty, it's still fairly superficial in its understanding of how the brain works. So it will take time to disseminate the information.
I'm certainly aware that there are many colleagues who don't believe. I have the welts on my back from meetings where the discussions were not as creative as they could have been, you might say. I do think the onus is on a researcher. If you want to establish something new, you really have to prove it exists. I think questioning is a good thing. Not accepting facts is a dangerous thing, but questioning is a good thing. And I say to my colleagues in this, keep an open mind. Ask more people about it. Think about it a little bit and look at the data, and just keep an open mind. For me, the most useful thing to change people's minds, to change colleagues' minds, and to make awareness is to understand the problem and to start to get to the physiology, the thing that's going wrong in the brain. So when you show someone brain imaging changes that are particular to, that happen in visual snow, and you can measure them, it becomes very difficult to say, well, that doesn't exist, because it clearly does exist. So for me, it's about, I want to prove the existence and understand the problem as I do that. And I think providing information to people, providing data, changes the minds of those willing to be changed, of course. I think the most convincing evidence we have at the moment for the existence of a syndrome, visual snow, is brain imaging studies that we did on this subject. So we took people who had the typical visual snow, so pan field all over the vision, sparkly little black and white dots that would move around. And we took people who didn't have that at all, totally normal matched controls. And we did what's called a functional imaging study looking at metabolism. So the brain uses glucose, sugar. You can label it, you can mark it in a way that you can see it on brain scanning. And if you compare the brain scan, the glucose scan of people with visual snow and those who don't, there's a very distinct area, unsurprisingly perhaps in the vision cortex, which is overactive, using more of this sugar, using more glucose than the controls. That's measurable, it's clear, and I think it proves reasonably without argument that this group of patients have a distinct problem that you can start to measure, and once you can start to do that, you start to try and understand it. The study tells us that the visual snow brain is overactive in just a small part of what's called the vision cortex at the back, the seeing cortex, in comparison to everyone else. And it tells you that's probably where the problem importantly is.
In life and business, in business, I mean, those of us who are in business always say, customer is always right? And so, I mean, give or take, I think a patient is always right. I think if a patient feels something is sincere, and we as physicians have clues in which we can tell. I mean, we've been taught in medical school, a patient that is sincere or not. I mean, obviously it's not 100% proof, but if you think it is, then a patient is always right. So there's something going on. So what I would tell my colleagues is that listen to the patient, and don't just trivialize this. Listen to it, or the patient. And if you can't figure out what's going on, what I would, and as a physician, it is our duty to rule anything that we can out. So all significant pathologies, to rule out. Once everything checks out, and that's our due diligence, is to do all the tests that we need to do to make sure everything's fine. Then we start looking at other things. Then I think that, as lifelong learners, physicians are lifelong learners. I mean, we're taught to be lifelong self-directed learners. I think that it is our duty to go maybe online, talk to other colleagues to see exactly what's going on, whether these symptoms are real or not. And I think that now, especially with this conference, I think that the word is out. There is social media, internet presence. And so if you even put the symptoms like pixels or multiple dots, visual snow will come up. And the rest is, and then the doctor will be able to sort of read that and be able to help his patient.
Please don't let the lack of awareness about visual snow thus far deter you from helping people who need your assistance. That's what I would say. I understand that research on something we don't understand can be daunting, but we didn't get where we are today as a society from sitting by and not intervening. So there's an emerging number of people who are affected by visual snow, and we can't ignore their cries. I would say as a doctor, the same way that maybe it's a painter's duty to paint, that you need to listen to your patients, and there's people who need help.